In today's episode, I will tell you about early signs of liver problems that can help prevent dangerous consequences. The liver is the largest internal organ in the human body and performs essential functions, including neutralizing foreign substances, removing excess hormones, storing energy reserves and vitamins, participating in blood formation, and much more. Therefore, problems arising from liver diseases affect the entire body. In general, the characteristic feature of liver diseases is the absence of pain receptors in the organ. Illnesses often occur without significant pain symptoms. A person only feels pain when the liver has significantly enlarged. Therefore, attention should be paid to the manifestation of any alarming symptoms. A healthy liver is the foundation of a healthy life, so it is crucial to timely detect primary symptoms of liver disease and problems and immediately begin treatment. These are signs of liver problems. Itchy skin. Liver cells actively produce bile, which directly participates in the processes that occur in the digestive system. After processing in the liver, bile is directed to the gallbladder through special channels. In case of the slightest violations of liver functionality, bile begins to accumulate and stops flowing, which in turn leads to its stagnation. Subsequently, these factors provoke itching and peeling of the skin. Sometimes painful sensations are observed. Such a problem indicates liver overload or the accumulation of a large amount of bile acids in the organ's tissues. Itching and liver problems can be localized on the soles of the feet, palms, or other parts of the body. If this symptom is present, it can be noted that it intensifies closer to night and when the body is warmed up, for example, after taking a hot shower. Changes in the skin of other typical skin. Cracks on the heels. The liver should constantly produce bile, which helps the body absorb these fatty acids, as well as vitamins E, C, A, and B3. These vitamins are necessary to maintain the tone of the skin. If the liver is not functioning properly or is not working correctly, bile is produced in insufficient quantities, and the body does not receive the necessary substances. For this reason, the skin becomes dry. If the problem is not resolved in a timely manner, it can lead to complications. Therefore, it is necessary to at least adjust the diet and maintain a drinking regime. It is better to enrich the diet with greens, vegetables, fruits, berries, and whole grain cereals. Edema. Problems with the liver can lead to problems with the kidneys and circulatory system. Malfunction of the system leads to water retention and accumulation of salts in the subcutaneous tissue. This is manifested by the appearance of pinpoint edema, mainly on the legs. Hair loss, often observed in liver diseases, can occur at an accelerated rate. The liver processes almost all of the nutrients that enter the body. If the liver function is impaired, the supply of building materials to growing tissues is also affected. Therefore, wounds heal more slowly and hair may fall out faster. Excessive sweating. If the concentration of harmful compounds in liver cells is high, the organ begins to work in an intensified mode, which leads to symptoms of excessive sweating and an increase in body temperature. Constant feeling of fatigue can be caused by the accumulation of harmful substances in the tissues of the liver. The body directs its energy towards detoxification of the liver, resulting in strong fatigue and exhaustion that does not go away even after a good night's sleep. This symptom is particularly important if a person is not subjected to excessive physical exertion or stress. To supply energy to the cells, the body needs to quickly receive nutrients from food. When the digestive process is slowed down due to the accumulation of toxins and waste in the body, a person often feels tired, cannot get enough sleep, and loses interest in doing anything. If the liver has difficulty in purifying the blood, all organs will be deprived of oxygen, significantly reducing their efficiency. Often, problems with sleep arise due to the increased concentration of harmful substances in the body, which causes the production of cortisol, a hormone that regulates sleep and affects the process of falling asleep. Chronic sleep problems can harm health. You should be vigilant if you experience increased sleepiness, difficulty concentrating, a sense of apathy, and a depressed mood. These are the first signs of liver problems. High fever is usually a marker of active inflammation in the liver, gallbladder, or ducts. Often, people with constant pain in the liver area experience a slight increase in temperature up to 37.8 degrees. In cirrhosis, thermometer readings can reach 38 degrees. Sometimes fluctuations are observed during the day, but they are more pronounced in the evening. Febrile fever is accompanied by such diseases as acute cholecystitis, langot, hepatitis, active cirrhosis, and liver abscess. Suppurative temperature is noted in chronic diseases, liver colic, and unpleasant odor from the mouth. An unpleasant odor from the mouth often appears when the liver begins to work excessively, putting all its efforts into purifying and removing harmful compounds from the body. Parenchymal jaundice is caused by damage to liver cells and usually develops gradually over a long period of time, so the patient does not notice its appearance. The sclerae and soft palate yellow first, followed by the underside of the tongue, palms, and soles of the feet, and then the entire skin. The color of the skin during liver jaundice is saffron yellow or orange. Mechanical jaundice is a consequence of obstruction of the common bile duct by a stone or tumor. It occurs suddenly and progresses very quickly. The color of the skin changes from greenish yellow to dark olive. Obstructive jaundice is accompanied by severe skin itching, abdominal enlargement. Almost all diffuse liver diseases are accompanied by an increase in its size. In portal hypertension, the spleen also increases in size. In severely ill patients, there is marked asymmetry of the abdomen with a noticeable protrusion of the enlarged liver. Difficulty in digestion can lead to bloating. In portal hypertension, fluid accumulates in the abdominal cavity, and its volume can reach several liters. The abdomen with ascites appears sagging, and the navel protrudes, spider veins. The appearance of vascular spider webs on the body are one of the first signs of liver problems. This sign indicates that estrogens accumulate in the cells of organs in large quantities. If this component is present in the body in excess, it has a negative effect on the vascular system. Some skin vessels can increase in size up to 2 to 5 millimeters. As a result, they become more pronounced and visible. Spider veins can also be observed on the legs, palms, back, and neck. Red spots on the body in serious liver problems. Red or brown spots begin to appear on the body. Such a rash can extend to the feet, and the spots vary in size from small to small plaques. They appear due to the deterioration of the blood vessels and impaired blood circulation. Primary signs of circulatory problems are manifested primarily in the lower extremities.